So when we run into a situation where somebody has had a nerve hydrodissection and it did not cause improvements or did not result in improvements. So when we run into a situation such as this, where patients have had a nerve hydrodissection procedure from another provider and they did not see improvements, there are a few things that we need to think about. The first is the quality of the technique. So Stan Lamb has published on this a lot, but the technique and the meticulousness that is required to truly hydrodissect a nerve is very, very high level and is very, very important. And so if you're not getting circumferential spread of that injectate around the nerve, then you're not getting a proper nerve hydrodissection. So that is one component. The second component is the actual solution that was injected may not have been appropriate or may not have been strong enough. If we look at the literature on carpal tunnel syndrome and nerve hydrodissection, what we see is that platelet-rich plasma does better than dextrose, which does better than saline, which does better than corticosteroid. And so all of those things can be helpful. However, we have to understand that sometimes a saline nerve hydrodissection may not be sufficient enough. The last thing that we want to look into is, was it the correct location? So somebody may say that they have, thoracic outlet syndrome, but it could be a misdiagnosis of a cervical radiculopathy. And so hydrodissecting the brachial plexus doesn't give improvements because it's not treating the root cause. So those are just some of the things that I think about.